Hello, I'm Rick Hours and this is FYI. Today, for your information, through the miracle of modern science, we have available to us a myriad of prescription medications that aid in everything from asthma to esophageal reflux to high cholesterol. But as today's expert tells us, there are several things that you should keep in mind if you regularly take prescription medications.
The first most important thing to know is what drugs you take. It's surprising how often people come in and don't actually know the names of the drugs that they take. They maybe know they take a little blue pill for diabetes or something like that. Drug names are hard to remember, so what we recommend, or what I recommend, is have them written down somewhere. You can get usually a printout from your pharmacy or write them down yourself, copy them off the bottles. But something that you have it written down and just stick it in your wallet, and then when you go to a doctor's office or anything comes up where you need to know what kind of medications you're on, you can pull that out. Clearly it's important to know how often you need to take it and if there's a specific time of day. Some drugs it's very important that you take them exactly the same time every day. Other drugs it's not really quite so critical. But it's always a good idea to have it a routine. It's really important to make sure if you're taking something every morning that you kind of hook it to something you already do. Like it may be a good idea to, when you brush your teeth, you always take your medicine right at that time, just because you're a lot less likely to forget it if it's hooked up to some routine that you won't forget. You never forget to brush your teeth, you won't forget to take your medicine. What to do if you miss a dose is really important. Some drugs have a really narrow therapeutic window, and what that means is the difference between the amount you need to take to be helpful and the amount you need to take that could cause toxicity or cause problems are very close together. So it's very important that the levels stay fairly even. So it's important to know if you miss a dose, is this one of those kind of drugs where it's really critical to keep the levels exactly even, or is it not that important? The normal rule of thumb that we give people, or that I give people, is to say the halfway rule, and that is if you remember to take it, you've forgotten to take the last dose, when you remember, if it's less than halfway to that dose, to the next dose, go ahead and take it. If you're more than halfway to the next dose, then just skip that dose, don't take it, and wait until that next dose is due, but don't ever take any more or less than is recommended. It's important to know if there's any serious side effects that you need to watch out for. Some drugs, for example, cholesterol medicines sometimes rarely have a serious side effects causing muscle aches, and that muscle aches can lead to bigger problems. So it's really important that you know, if you're on one of those medicines, that that's something to watch for. So if you get muscle aches, you need to make sure you tell your doctor. Other than that, it's important to know, to make sure that whoever is prescribing for you knows any other drugs that you're on. It's very common for people to go to a specialist for this and somebody different for this, someone different for this kind of thing, and so they don't realize that you have other drugs that you take for some other reason, and the drugs that you take may be interacting. So it's really important to make sure that whoever is prescribing knows everything you're on, and that needs to include vitamins as well as herbal products and non-prescription drugs.